So I've gotten a few questions lately about clarifying the difference between a CDA and an EFDA, an EFDA. A CDA is a certified dental assistant. No matter what education platform you go to school for, nobody is certified upon completion of any form of education. You must take and pass exams with the Dental Assistant National Board. That includes your radiology health and safety exam, your infection control, and your chair side. So there's 3 exams. Once you pass all 3 of those exams, then you are considered to DMB a dental assistant national, a certified dental assistant. I'm sorry. And EFDA is an expanded function dental assistant. So whether you attend an education program or you have some years of experience, then you can apply to go back to school to get a license to become an expanded function dental assistant. So what is the difference? DNB, the Dental Assistant National Board, at dnb.org, you can find a list of regulation policies that we are allowed to perform as a dental assistant and as an EFDA, as an expanded function dental assistant. So an EFDA is licensed to allow to place composite resin fillings. We can place amalgam fillings, placement of temporary crowns, placement of dental dam. We can polish coronal polished teeth, place fluoride. So an EFDA really can be utilized, if used properly in the dental practice, to really increase the production of the day of the practice. So a certified dental assistant has a different list of regulations and policies that you're allowed to do as a certified dental assistant. So one of the things, for example, that if you're a certified dental assistant, you have your CDA, you're not allowed to place sealants, which if you hold your EFDA license, you are allowed to place sealants. So there's times as an EFDA in my situation where sometimes I'll be hired to help a hygienist expedite their schedule. So if a patient is a 9 o'clock patient, maybe I seat the patient to take x-rays. The hygienist will come in and do the scaling. I then will step in, polish, floss, place the fluoride after the doctor does the exam, maybe make the notations on the chart notes for the day, and dismiss the patient. So that is a great way to utilize an EFDA to expedite maybe a hygiene schedule. When I'm utilized as an EFDA to help out with the doctor, a doctor might have a column or two with our high production schedule. Let's just say root canals and crowns. And then there's a certified dental assistant or a dental assistant that is doing four-handed dentistry with that doctor for those procedures. And then I have a column as an EFDA. So in my column as an EFDA, is scheduled an hour patient, maybe to do 2 occlusal, 3 MOD, 5 DO. So then the doctor will come in and get the patient numb. He or she will go back to their high production patient, come back to me and prep those fillings, and then I will place the composite resin fillings. I've been an EFDA for 10 years. To be honest, I don't place any amalgams. I've not worked in any office that really actively did amalgams, so I really personally don't have that experience. So those are just some key differences when utilizing an EFDA. If you're watching this and you don't think your office is really expanding upon the use of an EFDA and really getting the whole notion of what the skill of an EFDA is utilized for, then contact me and we can talk about that on the consulting side of things. If you're paying the hourly rate for an EFDA, then naturally you should be utilizing that EFDA to their full extent to help your production of the office, right? We're all here to make a paycheck, whether you're the business owner or naturally an EFDA waiting, or as a dental assistant for that pay as well. So just some key highlighted items. If you're not aware of what your list is allowable in your state, because every state is different, then you really want to check out that danb.org. So that's danb.org. If you're not familiar with that list in your state, I do highly recommend you get familiar with what you're allowed to be doing in your state.